Hello everyone, welcome to this Springboard Foundation meetup. So, in the current situation we are facing, there has been challenging situation the world is currently facing. In this, in these days, we are trying to find how technology can help fight COVID-19 coronavirus. In this sense, Springboard Foundation is bringing a live interaction with engineers from MIT and Harvard who have developed a safe path application that can be used to backtrace a person who has been tested positive without compromising the privacy of the person. We have with us Kristen Mary Wilkins. She is a system engineer. She has work experience in system architecture with large-scale projects. She is system design and management fellow at MIT currently. She has previously she has mechanical engineering and system engineering degrees from Cornell. At SafePath, she is actually leading the communication strategy team. We also have with us Kaushal Jain. He has a bachelor's and master's degree from in electrical engineering from IIT Bombay. After that he went to design smartphone cameras for Sony in Japan. He has done various tremendous work in the field of malaria elimination and also implemented technology in public health. He's currently pursuing his MBA at Harvard Business School. So, Springboard Foundation, we are a not-for-profit organization. We are established to promote innovation at grassroots level. We actually connect the people who have great ideas with people who actually can do something about it and transform these ideas into life. A quick do's and don'ts for this meeting. Thank you all for your overwhelming response. What we want you to do is we want you to not mute yourself. Please be on mute for the entire session. If you want to ask a question, please put it in the chat box, the public chat box, so that everyone can hear. We are expecting a network delay because everyone is at home now and we are all on the same, almost using the network. We will have the recorded session and it will be available on our YouTube channel. So no need, if you miss on something, no need to worry. So without further ado, I'll hand over the session to Christine, and you can unmute yourself and share your screen.
Great. Hi all, this is Kristen, and I believe Kaushal is on the line as well too. 1 second as we set up our technology on our end.
Hey everyone, this is Kaushal. Yep, we're just, I think, trying to upload the presentation.
Yeah. Should have it ready in a second. Okay, Kaushal, I'm going to try sharing my screen. Wish me luck.
Sure.
I think it's share your screen. Okay, great.
Yes,
Great.
Christine, we are able to see your screen.
Yes,
Great.
yes.
Kaushal, you get us started?
Sure. So firstly, thank you so much everyone for joining in. I think Rehan did a great job for the kind introduction. Thank you so much. So just as a quick intro, we are basically a community of students, epidemiologists, researchers, scientists, doctors, all the professions you can imagine, with affiliations from various places. So Harvard, MIT, Mayo Clinic, folks from Facebook, Google, who have volunteered their time to do something really helpful, hopefully, when it comes to the coronavirus thing. And we've put together a very large community of over 600 volunteers who are all working, who are all volunteering their time for this unique contract tracing solution for coronavirus. And the whole idea here is to develop something that's free, that's open source, and most importantly, that is private by design. So the key focus here is privacy for everyone, basically for the public health officials, for infected patients, for healthy individual, and like basically the whole community. The aim here, the problem that we're trying to solve is to sort of reduce the burden on healthcare systems, reduce the panic, and sort of help the society in general. And I think, Kristen, if you can jump in and give the broad overview.
Great. So I'm just going to jump into, so we are a contact tracing app. And not just an app, but really a whole ecosystem of things surrounding this app. But just to give some background to what contact tracing is and why we decided to go that route as opposed to exploring some other solutions. Normally, if you were diagnosed with COVID-19 or any infectious disease, you would have to work with a trusted health official and go back in time to try and figure out where you've been over that time period where you may have been infected and, passing this infection to other individuals. So for COVID-19, in most cases, this is about 14 days. It could be longer if you don't go report your symptoms right away and get tested. So if you can imagine 14 days of having to use your memory to go back exactly where you've been and try to remember timestamps for all those things and who you might have crossed paths with, especially if you were in a coffee shop or a McDonald's, isn't very accurate. And it's probably also, you're going to miss key locations. You're going to get the times wrong. And you just won't be able to remember 28 days or 14 days or 10 days or 5 days. So we saw a really great opportunity there. And one example of where this became incredibly difficult was patient 31 in South Korea, where they had to go back and trace more than 1,000 contacts just to find all the people that, could have passed to the individual, but also that this individual could have possibly also infected. So the challenge that we have going forward, because this is the particular part of the the particular challenge of COVID that we're trying to solve, is how do we avoid such a slow process and be more effective in slowing the spread of COVID-19 without building a surveillance state using contact tracing. So that's really what SafePaths is in general. We don't just want this to be used for COVID-19. We want this to be used for future epidemics. And because so much of the world's population right now already has a sensor suite on their smartphone, let's try and leverage that for more accurate results without sacrificing that individual or community privacy. By notifying a greater number of contacts and notifying them more quickly, we believe that can lead to COVID-19 containment. By keeping health officials in the loop too. So in this case, we don't just have the smartphone app, but we also have the Safe Places web application. We minimize bad actor scenarios and false reports. So some questions that we normally get are, well, why can't I self-report on my app if I've been diagnosed? In our process, you would have to go through a health official because that's so that someone doesn't go around creating these purposely walking around highly populated areas and then saying they're infected and then producing a whole lot of fear for those areas. So we just wanted the process to have a health official in the loop to do that. Our tools work with existing data sets, and the key principles that we've been following are to be simple, easy, intuitive for both the app user and for the health official that has to go through and redact any personally identifiable information from the data set. So I touched on our general process. So what would happen? You could go about this in any way. You should probably have an arrow that goes from step 3 back to step 1. But instead of relying on memory, a diagnosed patient can use their location history that's stored on our app. What would happen then is that instead of doing the patient interview the normal way, the health official would work with the Safe Places tool, redact any personally identifiable information from that location trail, and then get ready to publish that out to SafePaths users as part of a larger data set. And Kaushal is going to touch on later on how we make sure that this is private and secure. Once that all those data points from one patient interview, but from 1,000 patient interviews, get passed into the SafePaths app system, that's when you'll be able to know if your location has crossed paths with someone that's now been diagnosed with COVID-19. Great, Kaushal, do you want to take it over from here and then also fill in any of the gaps that I missed?
Sure. Can you move on to the next one, please?
Oh, do you want this one or this one?
No, the previous one, I think.
This one?
Okay, yeah.
Got it.
Yep. Thank you. So, like Kristen just mentioned, there are basically 3 steps in the whole process. Try to make it as simple as possible. And the project is basically planned in 3 phases. So the first phase was just to ensure that you can log your GPS trail using a simple app called Private Kit. The app is out on both Apple and Android Play stores, and you can download it today and test it out. Again, we are not in a full-blown public version yet, but there have been a lot of downloads, still figuring out some bugs and so on, and constantly trying to improve the app. But it works pretty well, I think, as of now. The second phase, and the app will enable you to sort of, if you don't have location history, if you probably download the app today, you can, if you have Google History turned on, take all the data from Google and then save it on your phone within that app. It never leaves your phone again, given the privacy preserving nature of it. And then you are empowered to basically export this data to the health officials in case you're diagnosed positive or in case some of the issues come up. But again, that happens in an encrypted manner and none of your private information is shared. Then the phase 2, which is hey guys, I think I can't see the big screen.
Did we just lose Kaushal?
I mean, I'm unable to see. Can everyone see the screen? Yeah. Okay.
Yes, we can.
Okay. I think there was some glitch. So in phase 2, basically, the health authorities will take that data and release redacted location trails. So take all the personally identifiable information from your trails out. So, for example, your private home or your private appointments and so on, they will all be taken out, and only the relevant, useful information for reducing the pandemic spread will be released out to the public. This is currently, as of today, this is currently being discussed with a lot of national governments across the world, as well as local authorities in the US. And we are planning to roll this out and work with the health authorities to coordinate and release this information using the web tool. And then the phase 3, which is a little more futuristic, I would say 3 or 4 months out from now, would be to reduce the burden on health officials altogether and sort of use a peer-to-peer kind of approach using cryptographic methods. So Ramesh Raskar, who is the professor at MIT, who is sort of leading these efforts, his group at the MIT Media Lab has invented this algorithm called split learning, and that enables a secure way to transfer this information and create a repository that further reduces the burden on healthcare officials. So that's how it's planned to be out. You can download it out today and check it out. But this is the web tool which the government agencies can use. So like Kristen mentioned, you export this data out to the web app, export this data out to the government authorities, and then they redact the personally identifiable information. So it's a very simple user interface, as you can see on the screen. This is an actual tool that exists today. So it has like a load, save, redact buttons, and you can just simply drag and select a big area and then delete the sensitive points or portions in the trail. This meets the US HIPAA standards. So HIPAA standards are privacy preserving standards, and we meet all the requirements. In fact, we have clinical expertise or medical expertise from Mayo Clinic who have helped us sort of comply with these standards. So if you're thinking about the Indian context, I think if it meets HIPAA standards, it should be easy to sort of meet a lot of international standards overall. Next one. Thank you. And so just to stress a little about the privacy preserving nature of it. We tend to think of it in three levels. So the first is the users, or the healthy individuals like you and me who are using the app. The next one is diagnosed patients, patients who are diagnosed positive. And then the third one is like public health officials. So for healthy users, like we mentioned, the data never leaves the phone. Everything happens on your phone, and even the contact tracing happens on your phone. So you have your own location data. You import or pull out the publicly released information, and then the comparison or the tracing happens on your phone. So that is privacy preserving by design, and you have to opt in. It's not like government or Big Brother is monitoring you and then figuring out who has come in contact. It is citizen centric and citizen empowering, in the sense that citizens themselves have the option of downloading the app, logging the location information, and finding more about their potential contact traces. For the diagnosed patients, like I said, the locational trails are never released in a raw form. All the identifiable information is removed and redacted. The transfer takes place in an encrypted manner, so their privacy is also preserved. And the public health officials. So here's the key thing: we need to work with the local authorities and health officials at least in phase two, out of the three phases that I mentioned, and they have the authority to remove the diagnosed patient's personally identifiable information. So in that, and in terms of where it is stored, it has, like, some of the countries have laws that the private data cannot leave a country's borders, and that is also ensured here. Any web server can basically do the job here by storing it out. So for example, if we were to implement this in India, in Bangalore, for example, we can ensure that all this is stored in the Bangalore server and does not leave out. So we do not need a server to be in the US or any other particular place, for example. Can you go to the next one, please? Yeah, great. And so I think this was a very quick overview of the overall effort. I think just to tee up a little bit about our team, like I said, we have great collaborators, people with affiliations from great places, including the Mayo Clinic. So, for example, Ernst & Young, which is a global consulting organization, is helping us scale this effort out globally. It has a lot of employees that are willing to help us, like thousands of employees willing to help us scale this effort globally, and taking it to various countries in the world. The World Health Organization has been a really great collaborator, in the sense we've been discussing, advising, mentoring. So WHO has played a crucial role in advising and mentoring us. And we're very close to closing negotiations with the WHO. We have great other global organizations, including IDARE, which is the digital health arm, I think, of the WHO, the Department of Health and Human Services of US, and many other sort of national health organizations to contribute to this effort. We welcome you all to join the team and contribute in whatever way you can. So no matter what expertise you have, no matter how much time you have, and no matter what in the world, you all can contribute to this cause. If you go to our website, which is safepaths.mit.edu, there is a join now button, which if you click, it will link you to a form and ask you about what skills can you contribute to. We all need you. I think this is a global effort. And Ramesh, who is leading the effort, likes to describe it as, it was just started as a small project at MIT, which kind of became into some sort of a big global movement now, and we need all your help to take this further. The key thing, like some of the countries have implemented it, but our philosophy is to think about it in a privacy preserving manner, which will eventually have long lasting implications to the society in a positive. So I think that's pretty much it. Kristen, I don't know if you want to add something here. We can take questions.
Yeah, I'll tag on just a little bit. So let's see. So I know a lot of it. I'm going to just touch on how we got started, because I think that this is normally a pitch deck that we traditionally use when we're talking to initially talking to city governments, but for all of you, just as you're trying to figure out how do you start efforts like this and how do you start these movements, Kaushal touched on it, where we just started as a small team at MIT about 2.5 weeks ago now. So the underlying research and technology has been developed over the past, I would say probably about 10 years. But realizing that there was an opportunity to apply it actually rallied a lot of people together really quickly. So essentially what happened was Kaushal was actually one of the first people to jump onto this effort and really shape it. And once he jumped on and realized that there was an opportunity, just simply putting the word out, because people are really coming behind they don't want to sit on the sidelines with COVID. They want to be involved and they want to be doing their part to slowing it and stopping it. So just honestly by word of mouth, this grew into a very, I would say, a 10-person team. 2 days later, a 20-person team. Maybe 3 days later, and then a week down the road, we had over 2,000 people on our email list. So people, I think it's that identification of real societal need and current technology that can really drive it forward. So in the case of contact tracing, the idea of sitting down with your health official is not new. We just found a way to do it better than has been done before in a way that doesn't sacrifice individual privacy. And that's really where we began. Kaushal, is there any other just things that you want to tack on, or any other questions that you kind of just want to address up front now?
No, I think this was fantastic, Kristen. Yeah, I think the genesis of this team was fantastic, like Kristen mentioned, and all of us are very motivated to solve this global issue, and if it helps in any ways, why not? Rihan, so I don't should we just take questions from the chat, or what's the format now?
Hello, am I audible?
Yes.
Okay. So generally, because of the large audience, we generally avoid the mics because there will be disturbances in their background. So there are questions already in the chat box. So if we could go over, shall I word out the questions for you?
Yeah, I can see some questions in the chat. I'm
Yes.
happy, Kristen and I would be happy to take some of those if that's okay. And
Yes,
then,
that should be
yeah,
fine.
people can keep typing the questions in the chat. I think both of us will monitor and keep
Sure.
answering. So, yeah.
Sure, that would be great. That would be great. Please
Okay.
continue asking questions, sir.
Okay. And just for my reference, how much time do we have?
We had a 30-minute session and 15 minutes question answer. So we still have 7 minutes of the session.
Okay.
So
Okay. Great. Uh, yeah, Kristen, feel free to jump in and answer. I think I'll start right up from
Do you want to start with? So is the app multilingual?
Yep. So we're working with translating all the app and materials across many languages. So I know there's folks working translating into Spanish, Italian. Some parts have also been translated into Hindi. Not the entire app though. So we're still working on it. And if you think you can help translate it into your local language, we would be more than happy to work with you on that.
See, so someone asked about privacy and privacy preserving, and if it would be compromised. So I'm going to take that one from a not very technical standpoint, and then be happy to discuss anyone offline with more technical information on how this actually works. But in this case, the thought is that by storing your location history locally on your phone, that essentially, we make it so that we can't see it on our end, and so that a government can't see it on their end. What does happen though, if you get sick, is you get to choose if you want to release it to your health official and make that patient interview process a whole lot better. But that is fully your decision throughout each step in the process. No one's forcing you at any point to actually release that information. And when it is released, what happens there is essentially the health official works with you, probably virtually in this case, to take away any points that could resemble your personal home or friend's home or anything else that would be personally identifiable. Once all those personally identifiable points are removed, the data points are just added to, well, there's no trace back to your phone, and then they're added to a larger data set and just merged together with a timestamp and a location. The thought is there that everything throughout this process is optional, and that there's just no personally identifiable information entering that data set and to start with. So if you're sick and you have a lot of location points at your personal house, that never enters the data set. So that way people can't figure out that it's you. Kaushal, is there anything that you want to add on to that? The algorithm behind it is developed at MIT in this organization called Triple Blind, and everything that they do is dedicated to preserving privacy. And if you guys know the RSA Secure ID tokens, I know I use one at work, and I think they're pretty international. We also have members from their team and their founding team on our team as well. The reason that we're all behind this is because we believe in this privacy approach, and we really do think that we're the only ones out there that actually does maintain a privacy-first solution.
Yeah, that was fantastic, Kristen. I think so. I'll just take another one here in terms of like literacy issues around some of the countries, and like how do you think it will work in remote settings and so on in case GPS is off and so on. So this app does rely on GPS for now. We are also working with the tech team to include some Bluetooth data, because Bluetooth data is more precise, I would say, compared to GPS, and it can give a more accurate representation of closer contacts. It's not yet out there in the app. We have a team working on as to include Bluetooth data as well. So combining both location data and Bluetooth data, we can get much more accurate picture. If you have your GPS off, well, then you could like store some of the Google history stuff if you already, but
Breaking up.
so this app will not work if your GPS data is turned off. You can get some information through Bluetooth.
I don't think that's on top of that.
I think it's someone needs to move their. Okay. The in terms of literacy, so people, if they don't know how to use the app, how can they use it? So we think that the interface is very simple to use, and we plan to translate it multiple languages as well. So that you could be able to use this app as well, because it's very like, I mean, they should be able to understand they've traced or not, and like can read or write instructions. Becomes Kristen, do you want to take some more questions?
Hi, sorry guys, I was just disconnected, so I don't know if I'm jumping into anything right now. but just real quickly, I know Kasha was touching on this. We didn't actually include it in our presentation, but we only log your location data once every 5 minutes. So for people that were concerned about battery life and GPS or Wi-Fi and how much data is actually being used, because we only log it once every 5 minutes, that's all our team determined was needed to actually produce accurate results. The amount of data that's actually being used is pretty minimal. We've tested this on a population of over 1,000 people right now in terms of battery life, and we've gotten really good reviews. And also data usage. There has not been too much of a spike.
Yeah. So there's some questions around evaluation and Bluetooth. I think just mentioned that we're still working on on adding Bluetooth features into it, and hopefully it will make it much more accurate and better, especially in resource constrained settings where GPS is not or may not be available on every phone and things like that. This question about scaling anonymity of users. So I don't really understand the context, but is it like, how can you scale if there are many users, the anonymous nature? So there's one component to it. When you sort of aggregate a lot of information, like from 100 users, it will be more anonymous and difficult to identify one user amongst these 100 users. So if you just release infected trails of many people, then it becomes very difficult to, or almost impossible to identify who each user was. We don't have any personally identifiable markers. It's just that this information, or you were on this road from 2 p.m. to 3 p.m. on 25th of March. That's it. Like, and if you have spent some time with on that road for that duration, you might be at risk. That's all the app will say.
And then there were two questions that I just want to quickly address. Maybe you already did when I was disconnected, but with so many cases in the US, is this app being used there, or is it really helping? So we are about to start our official pilot this coming week. And the reason why we're not just asking everyone to adopt it right now is pretty much we want to make it needs to work. This is a public health app, and we want to make sure that people trust the data and that the data is reliable. So we're working on, especially the past 2 weeks, everything was about forming partnerships with local governments. So that way we do have the health officials buy-in. So that data, the redacted patient data, would be released to us. But this week is when we're actually really looking at getting those pilots started and making sure everything runs smoothly. Once it runs smoothly, which again, hopefully by the close of this coming week, then we would be looking at expanding dramatically very quickly. Another question that was right with that one, how do you validate the data entered for the user? Wrong data can lead to unwanted circumstances. So that's why we're really trusting Wi-Fi and GPS in this case. In terms of, do we actually believe if someone's sick? That's what we're relying on the health official to officially add their data to the larger database. So it has to go through that human in the loop process.
Yeah.
Kaushal, do you want to take a few more?
Yeah, so I think the most recent one here is it safe to reveal unsafe or safe locations? And can it cause like more harm than good? So again, like we said, it is not revealing that these zones were unsafe. We're also revealing those with timestamps. So if you were in a particular mall, for example, in the morning, but the infected trail was only found in a couple of hours in the afternoon, then it does not become an unsafe location. We are nowhere saying that the location is safe or unsafe. We are just saying that did you intersect or did you cross paths with that particular location at that particular time, then you might be at risk. So the idea is not to put like a heat map of all sorts. The idea is just for you as a user to know if you've crossed paths with all the information that's released out in the public. And that should help with reducing panic and not creating more panic. So rather than saying that, hey, there are 100 cases in Bengaluru, if you can, and that can just freak out the whole population of Bangalore, right? So instead of that, saying that, hey, there were probably 2 or 3 cases in this particular area who were hanging out in this mall during this time, then the rest of Bangalore can sleep in peace, right? So 90-95% of the people who were definitely not in contact at that point in time, they have a peace of mind. So we believe that it will help here more than anything else.
Okay, and then there was one question about uh, the name SafePath in itself can give us a wrong information about the SafePath if no diagnosed patients are in the area, or if there are diagnosed patients in the area and they're not using the app. And I think that's a really important note, and that's something that we want to emphasize when we really bring this out for larger scale adoption. The app only works if a lot of people download it. So if your diagnosed patients aren't downloading it and they're not sharing their data, then you don't have that information that you need to make a decision. And we're not providing a risk assessment or anything like that. But what it comes down to in the end, at least from a perspective of someone that was living at college and I didn't know if I could go back home and visit my older parents, it gives you more information on, before you start showing symptoms, if you could be a carrier of this. At least that's the particular use case that I've been attached to. So the idea of, if this could take up to 14 days for me to show that I'm sick, I don't want to accidentally bring it to my grandmother or my father that has asthma or anything like that, for someone that could be, that this could have a really dire consequence to. So it simply gives you more information to make a decision on how you want to live your life. But the important note here is that every decision that you make with this is your decision. It simply gives you more data to do that.
Right. In terms of long-term sustainability, so the idea here is to help as many governments and officials as we can to roll this out in their jurisdictions. And then the idea would be, so for the phase 2 of this, the governments and we, the volunteer community, will hopefully jump in to ensure a smooth rollout. And in phase 3, when we say it's going to get a peer-to-peer sort of encrypted interface, this will further reduce the burden on the healthcare officials and the government, and it will truly be a decentralized platform. So 2 ways to sustain it. One, if you get a lot of users using this app and the government officials sort of releasing this information out on a common platform, it definitely becomes useful because the network effects will kick in on both sides. And 2, once it becomes decentralized, you by design you do not have a big brother sort of monitoring it, or somebody who has to spend a lot of resources in doing so. So there's very little maintenance to be done. It's as useful as everyone wants it to be. So it will be sustainable, is what we think at this point.
Great. If we missed any of the questions in the chat that you think we haven't addressed yet, feel free to add them right now.
Yep.
But I think we've covered most of them.
Yep, I think. And so if that's okay, we can close out in like a couple of minutes by 10:10.
Yes. Thank you, Kristen. Thank you, Kaushal. So, as final words, it would be great if you could add a few, 1 or 2 closing points on how we, as a Springboard Foundation, and all the volunteers that we have associated with this, how we could connect with you, and how we can contribute and collaborate with you to help.
Great. So I'll just jump in on that one to start off with. So first off, it's been great talking to you all. Thank you for asking such great, engaging questions. Going forward, as Kaushal already posted the link, but just go to safepaths.mit.edu. It's in the chat right now. On there, we have an email list to stay updated. We have a partnership list. We also have a volunteer with us list. So go through the site, see what's interested, but also download the app and get the word out. Note that, again, we still are in prototype mode. We hope not to be there for too much longer. And the way that our team talks is in hours and not days. So when we say we don't want to be there much longer, that really means we really don't want to be there for,